traditions as we head into Thanksgiving, and you're hoping to make Movember a tradition in the state.
And I was just looking at our Facebook page for a Healthier Michigan, and there's a great number of pictures out there from people all across the state that are showing their mustache growing this month, and that's what we want. We want to change the face of men's health, encourage people out there to do something different. If you're a man, maybe grow a mustache and just raise awareness of the importance of men getting that relationship with their doctor and getting the screenings that they need, especially if they get around the age of 40. Annual prostate screenings are very important to health, and we want to encourage people to do that.
Is there any evidence or data to show that the awareness has been helping, that people now more than ever have an understanding of what they need to do?
I think so. Movember has been a national movement for a number of years now, and there's a wonderful organization out there called the Movember Foundation that's the sort of the official governing body of the month and what goes on, and they raise funds for charity. But really the statistic that I am most impressed by is that if prostate cancer is diagnosed early by a doctor, early in the stage, that the 5-year survival rate is 100%. And when you think about cancer and how pervasive cancer is and how serious it is and how it affects so many people, that's the number we want to see. So we're encouraging men out there to have that relationship with their doctor. If they have a family history, their doctor should know it. And then around the age of 40, working every year with their doctor to make sure they get the screenings their doctor recommends. It is so important to save lives. And, you know, I want to stay in my family's life as long as I can, and that's what we're trying to get men to do, is to go in every year and get screened.
At what age would you say that again? Should you start getting the screening?
It really depends on the doctor. We are recommending that men around the age of 40 start to go in every year and talk to their primary care physician about screenings.
Talk with them about it.
If you have a family history of cancer, perhaps your doctor wants you to go in a little bit earlier. But around the age of 40, 45, that's prime time. That's when you need to go in and make sure that your primary care physician and you are talking about prostate cancer screening.